What makes sickle cell stem cell transplant recovery challenging? Imagine starting a journey to fix a long-standing problem in your body. A stem cell transplant offers hope for sickle cell disease, but the road to recovery can be tough. One big reason is that after the transplant, your immune system is in a fragile state. It acts like that of a newborn baby for up to 2 years, making you very vulnerable to infections. This means you need to be extra careful about exposure to germs and often requiring medications to prevent infections. The immune suppression used to stop your body from rejecting the new cells also adds to this risk, making recovery a delicate balancing act. Another challenge comes from the damage caused by sickle cell disease itself. Over the years, many patients develop organ problems like damage to the heart, kidneys, or nerves. Even after a successful transplant that cures the blood disorder, some symptoms like pain or organ issues might stick around or take time to improve. Managing these ongoing health problems while your body adjusts to the new stem cells can be physically exhausting and emotionally draining. Finding the right donor is also a major hurdle. Since sickle cell disease is inherited, it is more common among people of African descent. Many patients do not have a fully matched donor in their family or in donor registries. Sometimes, doctors use a technique called haploidentical transplant, which involves a half-matched donor. This approach requires special protocols to reduce the risk of rejection or complications like graft versus host disease, making the process more complex and recovery more challenging. The preparative treatment before the transplant adds another layer of difficulty. Patients often undergo intense chemotherapy or radiation to wipe out their own faulty stem cells. These treatments can cause side effects such as damage to healthy tissues, increased risk of secondary cancers, or other toxicities. This conditioning process is tough on the body and can extend the time needed for recovery. Psychosocial factors also play a significant role. Even after the sickle cell disease is cured, patients might feel isolated or overwhelmed because of lingering physical symptoms or emotional stress. Adjusting to a new health status requires not just medical care but also psychological support to help patients regain confidence and stability. In summary, recovery from a sickle cell stem cell transplant is complex due to immune system vulnerability, existing organ damage, challenges in finding a suitable donor, the intensity of pre-transplant treatments, and emotional adjustments. Each of these factors makes the process gradual and requires close medical supervision, patience, and a strong support system. Always consult healthcare professionals for personalized advice and care tailored to individual needs.